I am Dr. Wendy Mitchell, Medical Director of the ConnectCare Hub at Lowell General Hospital and Circle Health. The ConnectCare Hub, located at the Lowell General Hospital Saints campus, is a collection of clinics and programs designed to meet the needs of our complex patients. First, it is a set of clinics for patients with chronic illness, including a transitions clinic for patients with recurrent hospital admissions, a heart failure clinic, a palliative care clinic, a bridge clinic for substance use disorders, and a pharmacy clinic for medication management. It is also a referral hub to connect patients to clinical programs that can address other needs such as social determinants of health, care management, chronic disease education, and mobile paramedic services for the homebound. Next, it serves as mission control for patients that are on remote biometric monitoring in their homes with daily blood pressure, heart rate, oxygen saturations, and weights being transmitted to providers in the ConnectCare Hub. Our Transitions Clinic is targeted towards patients with multiple chronic complex conditions, high utilization of ED inpatient and subacute facilities, and who have significant barriers to care. The Heart Failure Program provides comprehensive and individualized disease management, education, support, and follow-up to patients with advanced heart failure with the aim to manage symptoms early and prevent avoidable hospitalization. Our palliative care providers will assist patients in navigating the care plan, managing symptoms, facilitating serious illness conversations, and identifying goals of care for our patients with advanced chronic conditions. The Medication Management Program provides patients with a connected care experience. It is a collaborative model between select specialty providers and our clinical pharmacists who aim to tailor a regimen that works best for the patient. Our mobile integrated health team consists of experienced paramedics, medical control, and navigators. We utilize mobile resources to deliver care and services to patients in coordination with healthcare providers via scheduled in-home or community visits. The ConnectCare Hub has proven to be extremely helpful for patients dealing with the challenges of chronic conditions. Patients tell me that they are relieved they can manage their condition at home with loved ones rather than constantly being admitted to the hospital. I've had many patients and family members completely overwhelmed and tell me what a relief it is to have a clinician that has access to monitor their health so closely on a daily basis. One of my favorite success stories is a patient that came to me a few months ago by the name of Thomas Bradley, who is managed in our Transitions Clinic. He was referred to the ConnectCare Hub after 3 recent back-to-back hospitalizations. He has advanced chronic obstructive pulmonary disease, or COPD, was new to oxygen, and was scheduled to see a specialist in Boston to discuss putting in an endobronchial valve that would help him breathe better. I will never forget the first time I saw him. He came in with his wife and daughter, was extremely short of breath, and was gasping for air. His legs and feet were so swollen he couldn't wear shoes, and the hospital socks had to be cut to fit around his swelling. He and his family were clearly overwhelmed since his condition had drastically changed in a few short months. Even after 3 hospitalizations, he was in daily distress and was quickly headed towards a 4th hospitalization. I spent almost 2 hours with the patient and family that first visit, which involved a thorough history, exam, lab work, disease education, and medication reconciliation and adjustment, as well as connecting with his home respiratory services provider to find an oxygen mask and portable oxygen canister that would be easier for him to use. I made a referral to our home telehealth program so his blood pressures, weights, and oxygen levels could be monitored daily. We placed an IV and gave him diuretic during that first visit. We expedited an outpatient cardiology appointment and also gave them records that they would be needing for their Boston appointment that was a few days away. His Boston specialist advised that the heart failure needed to be stabilized for 4 months prior to him being considered for the valve procedure. So in the meantime, he has had mobile integrated health paramedic home visits for IV diuretics, saw a cardiologist for medication adjustment, and his massive swelling has slowly resolved. He has received 6 paramedic home visits thus far, continues daily home telehealth monitoring, and I have frequent calls with him, his wife, and his daughter to address issues that arise and make necessary medication adjustments.
My experience has been nothing but positive. All the people are very nice. They know their business, and they do everything to make you comfortable as they can, and while addressing all the problems.
I mean, it's just been incredible. You know, they all came to the house. We had a respiratory therapist come in. We had the telehealth come in to show, you know, he does his vitals every morning. It's communicated. All the doctors can see his vitals every single day to make sure that nothing, and they do call. He's had several close calls with his breathing, that the BiPAP, had we not had that, he would have been in the hospital. I can't say enough about the whole program because it's been a godsend for us, and it's saved him on numerous occasions. I truly believe that.
There's been times, you know, when I was very close to coming in, and they've kept me out. They've sent EMT there. And I'm so grateful for this, you know, and you know, it's just like a kid finding a shiny new penny, you know. I got some hope. That's all.
The next time Mr. Bradley came in person to the clinic a month later, he was wearing new sneakers that he had got just for me to show me how much better his legs were doing. Mr. Bradley now has been stable and remained out of the hospital for over 2 months, and we were hoping to continue that pattern for the next 2 months so he can get to his next appointment in Boston.